Upon review of an informed consent form related to professional counseling, the West Texas Counseling and Guidance Informed Consent Counseling and Psychotherapy appears. The information includes the type of services rendered, such as mental health counseling, within a biopsychosocial, cognitive, behavioral perspective, the credentials of the therapist, as well as the therapist's scope of practice. Contact information to include the business hours and phone number, as well as the agency's cancellation policy, and a variation of the number and length of sessions is also made available on the consent form. Other topics included on West Texas Counseling and Guidance Informed Consent Form include the expected relationship between providers and clients, the goals, techniques of therapy and purposes, the duty to warn, confidentiality, information on how court proceedings affect confidential agreements, the risk of therapy, payments for services rendered, contact information if there is ever a necessary emergency outside of normal business hours, and the process of what will occur if the therapist becomes incapacitated or dies. Along with signing off on the aforementioned information, consent to treat, consent to be contacted via mail, phone, and email, and information on the agency's privacy practice is also included. All of this information is followed by a signature page that must be signed by the client. According to Section A.2.A of the ACA Code, there is an obligation towards the counselor to discuss the rights and responsibilities of the client and counselor. Upon receiving information on the counseling process, the ACA Code states that the clients have the choice to choose whether or not they want to enter into a counseling relationship. It is recommended by the ACA to include things such as implications of diagnosis, techniques and procedures, fees and billings, intents of using tests and reports, the qualifications and credentials of the service provider, the risk and the benefits, confidentiality, rights to participate, and information on records of the informed consent form. According to Defined Informed Consent in Tennessee, the communication between provider and client is based on what creates the informed consent. In Tennessee, there is a legal and ethical obligation of healthcare providers to inform their client of the risk and benefits of care. Along with the responsibilities of informing of the risk and the benefits, Tennessee requires the provider to provide the purpose of the treatment, alternative methods of treatment, the patient's diagnosis, and whether the procedure is experimental. In all cases, informed consent is necessary with the exception of emergency situations. At that point, the provider will assume that the patient's life should be saved by reasonable means. Comparing the informed consent form of Texas and Tennessee, it seems that Texas goes more in depth with the material they provide to their clients. However, when basing each form off the ACA requirements, both states cover vital information needed to cover all bases and potentially avoid court proceedings. Thank you.